So when we think about genetic testing, we tend to think more about testing a family rather than testing an individual. So our first goal, whether we're thinking about testing someone who has cancer or someone who's concerned about their family history and their risk but has not had cancer, is really looking at the entire family history and trying to determine who among that family should be the first person to be tested, and might that person be available and interested in testing. So we would look amongst families for who's diagnosed with breast or ovary cancer when they're the youngest. Is there someone who's had more than one primary cancer, both breasts involved or both breast and ovary involved? Might there be someone with another rare tumor that's associated with BRCA abnormalities diagnosed at a particularly young age? The reason for that is so that the test results, if they're negative, if they don't find a genetic abnormality, will be the most informative for the rest of the family. So we would try, if possible, to avoid having the first person tested in the family be someone who's not had cancer. That simply isn't informative for the other family members. There may be a gene in that family that that person who availed themselves of testing did not inherit. We also would try to avoid testing, as I would explain to my own patients. Don't test Aunt Bessie, who had breast cancer at age 85. For the same reasons, there could be a gene in the family that she didn't inherit, and she developed breast cancer as a quite older woman based on other cumulative lifestyle and environmental risk factors. Now, there are some times that that's not possible. There are certainly patients who've not had cancer who have very striking family histories for whom testing would be quite appropriate. And unfortunately, none of the patients or the women in the family who've had cancer are available for testing. And then testing for those patients would still be quite reasonable. We would also think about testing some patients who've had cancer, even in the absence of family history. That would include anyone diagnosed before age 50 or anyone diagnosed before age 60 with a triple-negative breast cancer or who comes from an Ashkenazi Jewish heritage. The reason for that is that family histories are often imperfect. Sometimes there's no family history of cancer because there just is a small family or a family of predominantly men, so there aren't very many women who have survived to adulthood to be able to give information. So we need to remember that a negative family history should be viewed very differently in those patients, particularly with small families, than a negative history in someone where every generation has 9 daughters who've lived to age 95. That's a negative family history that's reassuring. A negative family history with a mother who died in a car accident at age 25 and grandma who nobody knows what happened to her because she was still in Russia, that's just not informative rather than being negative.